Okay, step 9. Inform the patient and the family. And my practice is to tell the truth if they want to hear it. And our skill as doctors is working out what they're ready to hear. So there's this concept of therapeutic privilege. Do we be paternalistic and withhold information like we used to do for cancer? Or do we tell people the facts? And so what I say, look, there is a problem with your memory. The tests show that there's a degenerative cause happening for this. Would you like some more information about this? This is a condition called Alzheimer's disease. This is not something that's going to change your life from today to tomorrow. It's a very slow process over many years. And there are things that we can do to slow the progress of symptoms but not stop the underlying disease. And they're certainly possible to have a very positive quality of life for many years with this condition. If the person is very anxious or depressed, you have to give them a lot more support through this process. The families are pretty well always told. There's a tricky thing about should you tell the family without telling the patient, and that's something you'll have to judge on a case-by-case basis. But really, there's a confidentiality issue, and it's wise, I think, to clear it with the patient. Disclosing a diagnosis can lead to increase in depression or anxiety, stigma, leprosy syndrome. People stay away because they're frightened of this disease. Patients may give up or decompensate, and family members might be worried about themselves. Now, our risk of suicide. Now, I don't see these problems very much. We provide support after the diagnosis. We ask them to come back within a couple of weeks, see them again, follow up and see what's happening. We sometimes see families who have a lot of trouble with this. They might be frightened, or they may decide they're going to fight the disease. One woman I know started teaching her husband German to try and stimulate his brain. Sometimes we see families where half the family will agree and try and work it out. The other family say, no, they're wrong, the doctor doesn't know what they're talking about. And in fairness to them, we are sometimes wrong. We do get it wrong, maybe up to 5% of cases. And sometimes there's rivalry. Two daughters. One says, well, I want mum to come and live with me. The other one says, no, I want mum to live next door to me. Maybe there's money involved. So, strategies for breaking bad news. Prepare the patient, include others that the patient would like to be present, correct misperceptions, and give as much information as the patient is ready for. Titrate it to what the patient's ready for. Present the information clearly, reassuring. I also offer some hope. Now, there's a lot of research going on. Maybe there'll be something that can actually stop this disease. We have to acknowledge that this is difficult for the patient, and we have to be available for the patient subsequently. And offering a second appointment, I think, is good medicine. My practice is to see the patient and informant separately, but tell them the diagnosis together, if that's what they want. But it takes time, your most precious commodity.